Okay, now I'm going to talk about the largest bone of our body, which is the femur. This is going to be the bone that runs from the hip to the knee. You remember the term femurs pertaining to the thigh region? So huge, long bone. So let's just kind of orient ourselves first with the femur. If you see this somewhat spherical shaped region up here, this is the head of the femur. This head is going to articulate with the acetabulum of the os coxae. So this would be the proximal region of the bone, and down here would be the distal region of the bone, which is going to help make up the knee joint. Okay. To be able to tell what's anterior or posterior, very easy way to do that is, I'll go ahead and turn it around. This is the posterior part of the bone, posterior side, and I know that because at the distal end I see these two huge knobbies. These are the condyles, okay? The medial and lateral condyle, which are going to articulate with the condyles of the tibia. So if you see these big knobbies at the distal end, these condyles, this is the posterior view of the bone. Okay, so if you see the knobbies, posterior. If you don't see the condyles or the knobs, it's the anterior. So this is the anterior, this is the posterior. Then to be able, when you know that, okay, you cannot tell what's right or left by looking at the angle of the head, the neck and the head of the femur. Okay, so this is the anterior, and look, the head is going off this way, and we know that it's going to have to fit into the acetabulum of the os coxae. Okay, so this is the left, this is the right. Okay, so this would be the left, and this would be the right. Okay, because this is anterior, and the neck and the head have to go into the body to fit into the acetabulum of the os coxae. I've already discussed the head, and the head articulates with the acetabulum of the os coxae. Here on the head, you'll see this kind of divot. This is the fovea capitis. Okay, fovea is a depression, capitis referring to the head. The fovea capitis is where it's a ligament attachment site. So this is the fovea capitis. If we look at the posterior side, I'll point out a few structures. This cylindrical region connecting the head to the rest of the femur, this is the neck. This is the neck. These processes, these rough kind of processes that jut off, these are called trochanters. This is the greater trochanter. This is the greater trochanter. Remember, greater, larger, but also usually when we use the term greater, it will be superior as well. So this is the greater trochanter. This is the lesser trochanter. And they serve as attachment sites for several muscles of the lower limbs and buttocks. So this is the greater trochanter, this is the lesser trochanter. Continuing down the diaphysis on the posterior side of the bone, this region right here that kind of sticks out, this is called the linea aspera. Think linea, it's a line. Linea aspera. And remember, it's somewhat medial in the medial region of the bone along the diaphysis on the posterior side, linea aspera. This is the attachment site for several muscles of the upper leg. Down at the distal region of the bone, these condyles, I'm going to talk about these again. Easy way to very quickly tell which one is medial, which one is lateral. If the condyle is in line with the head, it has to be medial because, again, the head goes into the body, right, and attaches with the acetabulum of the os coxae. So this has to be medial. This is medial. So this is the medial condyle in line with the head of the femur. This is the lateral condyle in line with the greater trochanter. Okay, so medial condyle, lateral condyle, and these are going to articulate with the medial condyle and lateral condyle of the proximal end of the tibia, respectively. Okay, let's see, and help make up the knee joint. The next are the epicondyles, and these are going to be, epi means above, so they're going to be small little condyles that are above the larger condyles. So this region right here, this would be the, because we're still on the medial side, this would be the medial epicondyle, and over here would be the lateral epicondyle. Okay? All right, and then same thing with this bone. I just only went through the left, but that is the femur.